Hey everyone, Dr. McClellan here again. I wanted to do something a little bit different this time. I'm at ASPS, that's American Society of Plastic Surgery meeting in Chicago. And I wanted to give a little perspective. I love these meetings because I get to talk to residents I know and med students I know, and it's a very active, dynamic place. And as you know, I love to educate students and residents, and in particular, I get a lot of emails about med students that want to go into plastic surgery, or general surgery residents want to go into plastic surgery. And so one of my friends, this is Dr. Rahman Barry. He's a fifth-year general surgery resident, and he just matched in plastic surgery
Correct.
at Vanderbilt. Congratulations.
Thank you.
I wanted to bring Dr. Barry on to talk a little bit about getting into plastic surgery. What are some of the things you can do to improve your application? What are some of the things you can do at the interview, etc.? And I really want to thank Dr. Barry for the time to talk to you guys and give you a little wisdom. So, Dr. Barry, why did you decide to go into plastic surgery?
I think that's a decision that I confirmed a little later down in my residency. I knew I had an inclination towards surgery very early. I wasn't quite sure what area in particular, and that was probably one of the main reasons I pursued general surgery, because of the options I had at the end of the day.
Right.
I was fortunate enough to be in a program where I got broad exposure to subspecialties, and I think early on in my training I went back and forth between different surgical subspecialties, but I always did like plastic surgery from the moment I was exposed to it.
Right.
And I think the more that I got exposure to it, the more I understood all that was involved in plastic surgery beyond what's probably highlighted. Certainly prior to being in residency, people have a different perspective and different perception of what plastic surgery involves.
Right.
The more I became aware of all the facets of plastic surgery, the more it began to appeal to me. And I think certainly in my second and third year of training, I knew for sure that's what I wanted to pursue.
That's great. In the U.S., there are two paths to go into plastic surgery. There's the integrated out of medical school,
right,
and the independent through general surgery, which is what you're doing.
Right.
They each have their pros and cons, but the things that you do to get into plastic surgery are probably very similar. Would you agree?
I'd agree with that to some extent.
What are some of the things that you did to get into such a good program like Vanderbilt that you can tell med students and other residents might be helpful for them?
I think that your approach is somewhat different depending on whether you're aiming for an integrated pathway versus an independent pathway. I guess I'll speak first towards the independent pathway, which is the path I chose. So in general, what that means, since over the last several years, it's transitioned universally to a 3-year requirement, right, after general surgery or some related surgical specialties such as ENT, some degree OMFS, neurosurgery, and orthopedics. But traditionally, people pursue it after general surgery. It's 3 years. In my cycle, there were around 40 programs that were involved in the match.
Right.
Accounting for probably just under 70 spots total. So certainly there's a degree of competition, and
are there fewer spots in the independent pathway compared to the integrated pathway?
There are, and I think that most people who have pursued that pathway have realized that over the past several years there's been a gradual decline. You have more programs transitioning to an integrated pathway or a combined, where some spots are dedicated to independent residents and some dedicated to integrated residents.
Right.
And I think that's certainly during my interview trail, I noticed that was continuing to be a trend, where there are programs that were planning to transition to an integrated pathway over the coming years.
Right.
So certainly competitive, and I think that probably highlights the need to make yourself a competitive applicant to be successful.
Yeah, it was reversed when I went through. It was more independent pathway than integrated, and I have seen the change. And so I think one of the bad things for the integrated pathway is you have to make up your mind what you want to do so much sooner than you do in the independent, and probably exposed to less type of surgeries. But I would assume that what's your view on like research? In med school, were you exposed to a lot of research, or residency exposed to a lot of research? Do you think that had a bearing on you getting in? And I'll tell you what I think, but I'd like to hear, as a recent match, what you think.
So I'll mention briefly about the integrated pathway and then a bit more about the independent pathway as far as research goes. I think it's universally understood that if you're pursuing plastic surgery from an integrated pathway standpoint, you need to have research and you need to be ideally aiming to have a few publications to consider yourself competitive at all when you consider the high quality applications that programs receive from an integrated standpoint.
Right.
The expectation almost across the board is that you're going to have great USMLE scores, you're going to have published research and certainly several research interests, and of course dedicated time where you've rotated through plastic surgery programs either of interest or where you've gotten letters of recommendation from
Right.
these patients, from these attendings. So certainly if you're pursuing an integrated pathway, that's essential. The independent pathway, I'd say, varies a bit more. There are programs which encourage research a lot more than others and facilitate research a lot more than others. Some with dedicated research years built into their general surgery program, and some which give you the option to pursue that path if you so choose. And I can say certainly when I went through the match cycle, there were probably a lot more people than I realized who had dedicated research years. I didn't have that option personally, but I think that it certainly strengthens your application. I think that if you don't have that option or if you don't want to pursue dedicated time off for research,
Right.
and you're pursuing an independent plastic surgery pathway, you need to, from day one, try and have yourself as, motivated as possible to produce research papers and get published.
Right.
So I think that when I applied, certainly I had a few publications and several in the works.
Right.
And other research interests such as grants that I was involved in. I think all of those combined probably put me on similar footing with people who had dedicated time off for research.
The one thing I would mention about that is I don't think the research has to be related to plastic surgery. I think it just has to show an academic interest to these program directors and chairmen. I know when I came out, I had a lot of urology research, specifically bladder cancer, and it didn't matter. They were interested in talking about bladder cancer and just research in general. What type of research do you want to do, etc. So I would encourage everyone out there that if you don't have exposure to plastic surgery, wherever you may be, any research is good to show an intellectual mind.
And I'll reinforce that point. The advice that was given to me early on is just that, show a research interest more than anything else.
Right.
And the majority of my research was general surgery related, mostly because that was what I was able to pursue research in,
right.
and had attendings who were motivated to do research in at the time. I had probably one plastic surgery research interest with my application, but again, the vast majority was research interest outside of plastic surgery. I think that's the key, showing that you are someone that's willing to put in that extra work and that you have an interest that can be translated into another field if necessary.
Completely agree. And I think that the people out there that are, I don't think research is going to come to you. You need to show this self-starting initiative to go out and find an attending that wants to do research or find an interesting research project, because that shows your self-startedness that plastic surgery programs want. And I think research is really critical. It may not get you into a program, but it at least puts you on equal footing to other applicants.
I agree. And I think one important thing is that that's a checkbox that needs to be ticked. And you don't want to come up as deficient in research and certainly put in another category from another applicant. I think that, looking back at my experience, I'm in a very busy general surgery program clinically.
Right.
And I found the feedback that I got during my interview trail from the people I interviewed with was that they appreciated the fact that despite a clinically busy program, I was able to find the time to do research and have output.
People are looking at that. Well, you want to separate yourself from the other applicants. And if you're very busy clinically and you still have the time to do research, that says to the people that are interviewing you at the program that, hey, this guy's going to come here, we're going to be able to, or girl, we're going to be able to work them clinically, and they're still going to produce research.
Absolutely.
Because many of the programs that you're going to want to go to, they're going to do research.
All right.
Tell me your thoughts. In my personal opinion, having gone through the match, having interviewed students, med students, and interviewed for residency programs, tell me about the interview. What do you think are some of the key points for potential students or general surgery residents as they go into the interview process to increase their chances of matching?
I think recognizing that the interview starts before the day you go to interview is critical. I think that everyone should be planning from the day that they've gotten an interview offer, researching as much as they can about the program, the faculty, ideally what their interests have been based on publications, the residents that are there, and whatever other information is available beforehand on the program.
Right.
I think
Sun Tzu said that.
Yeah.
Know your enemy.
I agree, 100%. And I think going in prepared is the key, and it sets you up for success. The actual interview day, I'd say almost all programs have pre-interview dinners, and it's critical to recognize that your interview has begun the day that you first meet with anyone on faculty or anyone that's in training. I think that certainly being conservative is key.
Yeah.
Both at the pre-interview dinner and on the interview day.
Yeah.
You don't want to be the person known to stand out based on how they dress,
right,
or based on how much they're able to drink,
right,
or anything that may in any way be construed as inappropriate.
Yep.
The pre-interview dinner, I guess it's appropriate to start there. It's going to be a time where you should have prepared questions that you want to ask current training residents / fellows, faculty that may be there, coordinators that might come, and the people who come vary based on programs, but I think that you will get more comfortable the more interviews you go on, but your preparation for all those questions you're going to ask and the interaction you're going to have should start before that day.
Yeah.
Certainly your goal is to find out as much as you can about the program in a setting where there is less stress, and that's the idea in general, I think, behind the pre-interview dinners, that you're able to interact with residents in a less formal setting and find out whether or not the program may be a good fit for you.
Right.
Find out more about the people that are there, the faculty, people that you're going to be working with for 3 years.
Yeah. One other thing I'll say about you brought up that other people will be at the dinner or pre-interview gathering,
right.
And that can be residency coordinators, it can be nurses, it can be, I've seen scrubs,
sure,
at the mixers, because many of these plastic surgery programs are small,
right,
and they want good people. And one of the things that I've seen people do that I absolutely hate is they'll be nice to the doctors, or they'll be nice to the other residents, and then they won't be nice to the coordinators or the scrubs. They won't interact with them in the same way. I think that's really poor form. And remember, you should treat everybody equally nice and be friendly. Even the person sweeping the floor, you guys should be very nice to them as well, because you never know. I think number one, I think it's good karma, and number two, you never know the influence of that person.
I agree.
And so,
100%.
With everyone, you guys should be free and open. How about the what do you think these programs are looking for when they're interviewing someone? What are your thoughts on that?
Well, I think that everyone would agree that the plastic surgery match is competitive, that you have several more people applying for these spots than they have spots available.
Right.
And I think that, by definition, that makes it a competitive match. So I think the key is to look on the things that you can change when you apply. And they're going to look at your objective performance during your training. Certainly, USMLE plays a role more so in an integrated match than in an independent pathway.
Right. An independent ABSITE scores are very important.
Correct.
Let's say you have great USMLE scores. This guy scored off the chart on the ABSITEs. You really, as you're progressing through general surgery, you will be looked at on ABSITE. So that's very important.
I think that from day one, during general surgery training, doing well on your ABSITE should be a priority.
Yeah.
I think that when you have 120 applications and you know that you're only going to interview 20 people,
right,
the easiest way to slash it in half, objectively looking at people from different programs who've been trained differently, is to say, well, objectively this person is in the bottom half in objective standardized testing,
yep, compared
to the top, and they won't even look on your application.
Yeah.
So it's critical to do well on a standardized exam,
Right.
which you're compared against your peers.
Yeah, completely agreed. I think the first cut, there are multiple cuts that these residency programs do when they get so many applications. And I think plastic surgery obviously is competitive to get into. But number one is going to be board scores.
Right.
Both ABSITE if you're in general surgery or USMLE if you're in the integrated program. But that'll be the very quick first filter. They'll look at those scores and just put them to the side very quickly.
The other thing is, letters of recommendation.
Yeah.
And, hopefully people are in a program where they can get access to plastic surgeons to write them letters. Usually the program director for their general surgery program will write them a letter. Ideally, of the 3 letters, you may want 2 letters from a plastic surgeon and 1 from your program director.
Right.
But I will say 100% that a letter from a plastic surgeon, if it isn't a very strong letter, it's not better than a glowing letter from a general surgeon.
Completely
who knows
agree.
you well.
I think that the letter of recommendation is very telling.
Right.
In general, most letters of recommendation you're going to get are going to be good.
Right.
However, some of the key things that they could say, for example, let's say that you had a choice between an academic plastic surgeon to get your letter from or a private practice plastic surgeon. Go with the person who knows you better, who knows your work ethic, who knows your research interests, and could write that detailed, personalized letter and not just simply a boilerplate letter. So who you ask is important, number one, and also how you ask them. You just don't want to blindly ask someone for a letter of recommendation. You should say, can you give me a favorable recommendation?
Right.
Would be how I would ask it. And then finally, once you get to the interview itself, what would be something that you would want to highlight on the physical interview with the program?
I think, again, preparation is key here as well. Whether you're going for a integrated spot as a medical student or an independent spot as a resident, you need to be prepared, one, for the questions that are commonly asked, and you need to know, be able to, one, describe your research that you've done, 2, explain any deficiencies that you may have had on your application, certainly explain your interest in plastic surgery, the reason why you like that program, typical questions where you see yourself, etc.
Right.
But you want to highlight your strengths.
Yeah.
You want to certainly not have deficiencies if you can help it, but if you do, you want to either explain them while highlighting your strengths.
Right.
And certainly try to put your best foot forward to each interviewer, not just the program director, not just the chairman. A single bad interview with anyone who interviews you can kill your chances.
What was the best question or most common question that you got answered for people to prep for?
I would say, the first thought is that I think that interviewing for plastic surgery is probably a little bit different than it was interviewing for general surgery. It's a lot less malignant in terms of the questioning, as I found. It was more relaxed, more them trying to find out more about you, certainly them wanting to hear the questions that you have because there's the expectation that you'd have done your homework about the program and that you want to be there. Everyone you go to is going to ask you what questions do you have. Try to be insightful if you can, but certainly, do your research so you can have legitimate questions.
One thing, don't ask how much vacation there is. Don't ask how much you get paid or how many nights off do I get. Don't ask those sorts of questions.
Yeah,
ask insightful questions about, do I have access to research money, or do I get to travel to the American Society of Plastic Surgeons meeting if I get research accepted? Questions like that. Because I've had residents come in and med students, and the first question they ask is, how many weeks vacation do I get? Yeah. That's typically a bad sign.
It is. And I think what also helped me, and I think that I would encourage most people to do it, would be to find an academic mentor or find attendings in your program and have them go over questions with you.
Yeah, that's great. Like a mock interview?
Mock interviews.
Yeah.
Practicing is key, and I think that even if you formulated your responses, getting feedback on what you plan to say and how you can improve what you plan to say, as well as other questions you may not have thought of, and certainly someone who may have reviewed the application that may see things which they would ask about, which you may not have noticed. I think those are all important things to address before the interview.
One thing, and please comment on this, one of the things that I found, having interacted at every level of interviewing for plastic surgeries, is plastic surgery programs are very small. Some are one resident a year, two. The largest is probably 4 residents or 5 residents a year, but in general, they're small. Having a bad apple or someone that drops out or quits or someone who's problematic is really something that these people are trying to look at.
Yeah.
Is this a person that I'm going to want to work with 23 hours a day for 6 years or 3 years?
Right.
And so the key thing is be yourself, I think, and let them know who you are personally. Do you like to fly fish or kayak, or are you a runner? What do you do outside of medicine with your family? Let them know how human you are. That would be big. And the second thing is that how much of a fighter you are, that you overcome adversity, and that you're going to stick with things through tough times. Because residency, as you know, particularly general surgery, very hard.
Absolutely.
Lots of challenges. What do you think about that, and maybe something that you think is important for someone that's interviewing is to say?
I think that, again, going back to the interviews being where they want to know more about you.
Right.
I think that a lot of the interviews were, as I said, seeing if you're going to be a good fit. So they'd ask about your hobbies. Certainly, you never want to put anything on your application that's not truthful.
Yeah, always be honest.
You never want to say that you do a sport if you don't do a sport.
Right.
You want to be able to be honest, because the truth is that it's just as much about you being a good fit for them as it is them being a good fit for you.
Yep.
And I think that, certainly that preparation is critical. I think that you want to try to be as honest as you can, as relaxed as you can, and it's expected that certainly early on during the interview trail you're going to not be as comfortable in these situations, but the more you become familiar with the process, the more that you've been asked the same question over and over, the more natural it will be your responses. I think.
Bring up a great point. So let's say that you matched at Vanderbilt. Let's say that was your, I know it was your number one choice,
right,
which is excellent. But what if you knew Vanderbilt was number one? Did you go to other programs, maybe 2 or 3 programs before, to get some experience and understand the interview process, so that when you showed up at a place you really wanted to go, that you were better educated about the process?
So I went on 15 interviews total, and I think that each interview I went to prepared me for the next. Mm-hmm. And I think that my performance in interviews, my comfort answering difficult questions, that improved tremendously each subsequent interview I went on.
That's great. That's important.
And so I think that even if I knew I was going to rank them number one, even if I knew I was going to master, I have zero regrets going to every single interview I did, because I would not have been as good an interviewee as I was had I not gotten that experience. So I would add to that as well that, I think that what I was looking for in a program really changed a lot as I progressed through my interview course.
That's also very important.
And interacting with the other applicants, finding out what programs had to offer that others didn't, and which programs were deficient in certain things which you didn't know to look for before. Certainly what I started looking for as I went on more interviews changed, and my idea of an ideal program changed throughout the interview process. And knowing what type of environment I wanted to work in by seeing what else is out there, I think that also significantly impacted how I ordered my rank list.
So you could compare and contrast different programs based on deficiencies, maybe operative independence in one program, resident cosmetic clinic in another program.
Correct, exactly.
Those are really important points. Anything else you would think of to tell a young person that wanted to go into plastic surgery about the match process?
Of course, try and make yourself as competitive as possible. That's a given. Do well on your boards, do well with research, set yourself up for success in terms of getting letter recommendation, rotate on plastic surgery whenever possible. I think starting the process early is critical, because they have certain procedures which are lengthy processes, and certainly getting credential verification can in some instances take months. I think it's critical for you to do your homework early to understand the process that's involved and to start that process early. And I know several people who started a few months before that, they still didn't have everything ready by the time applications were due. But I think also it's critical to have everything ready to go the moment the applications are ready to be accepted.
To get them out there first.
I think that if you're not, then certainly it reflects poorly on you. And
I completely agree.
There are programs that give out applicants invites very early.
Right.
And not having your application in that pool essentially rules you out regardless of how strong a candidate you may be.
That's a great point. Well, I really want to thank you for taking time out to join me. As always, if you guys have any questions or concerns about the match, you want to know more, please leave a comment, and I really appreciate it. Thank you so very much.
It's my pleasure.